So CII-CPAR stands for Community Information Integration and Central Patient Attachment Registry. So this is a provincial electronic system that enhances patient information flow and care coordination for healthcare providers.
This CII-CPAR integration, it helped us to plan ahead before the client has been discharged from the hospital.
One of the things that fails from hospital to community is we don't get the discharges. So knowing that they were visiting the hospital for an ailment, then we can actually follow up with them, which we never could before because we never saw that.
Previously, this technology was only available to physicians, and so the First Nations nurses are the first to access this.
CARE is the EMR that we use here for our home care program. This is where we document our care for our clients, and it is also a platform for care coordination.
Before CARE partnered up into the CPAR program, we were having to go out of our program into NetCare, look up the medications, look up the client's record when they were in hospital, or even check NetCare if we couldn't find a client to see if they were in hospital. Now with the CPAR program, we're able to see in the mornings, we get a panel so we know who's in hospital, who's paid a visit to emergency, and we were able to keep better track of our clients that way.
With improper communication, we cannot plan ahead. We cannot create a care plan for the client. From the past, there is no appropriate discharge planning that's been happening from hospital to home care. Sometimes a client has been discharged already and is back home and we didn't know about it. So having this CII-CPAR integration, it helped us to plan ahead before the client has been discharged from the hospital.
It's been easier for the nurses now in keeping track of their clients, and it's also been easier for our discharge planner when she goes to hospital to discuss the client, and so that we can plan for discharge and for them to come home and have success rather than that complete revolving door that we see sometimes, especially with elders.
It makes our work much easier, and I think the care for our clients is more continuous, at least. Like, it's there, the care is there.
So CII-CPAR is the information pipeline for the future of information to flow from Alberta Health Services to community providers. So more and more information will be coming to First Nations nurses on reserve. So things like lab results, hopefully diagnostic results. As the province expands the program, we're hoping that more and more information will be available to the nurses at their fingertips.